I'm Shannon McLain Sims, the creator of the Diaphragmatic Vagal Repair Method, and I'd like to spend a little bit of time during this video explaining the process and science behind this method. The DVRM is a two-step somatic breathwork practice to help rebalance the nervous system and better manage the numerous persistent symptoms following a COVID-19 infection, often referred to as post-COVID syndrome or long COVID. Somatic breath work allows the mind and body to reconnect intentionally with the experience of breathing. We know that COVID-19 wreaks havoc on the autonomic nervous system and causes an imbalance among many of the body's systems, which could explain many of the long COVID issues like poor oxygen saturation, anxiety, post-exertional malaise, or exercise intolerance, gastrointestinal problems, muscle spasms, elevated or high heart rate, palpitations, and high blood pressure. And all of these bodily functions are controlled and influenced by the nervous system. So a key player in the autonomic nervous system is the vagus nerve, which helps the body to handle stress and maintain balance among the body's many systems. The vagus nerve helps to regulate the autonomic nervous system, but this function, it's thrown out of balance during a COVID-19 infection. When the autonomic nervous system is out of balance, the body is stuck in a constant fight or flight stress response. The vagus nerve is our 10th cranial nerve that originates at the base of the brain and wanders throughout the entire abdominal cavity and connects to the diaphragm, which is that balloon-like muscle attached to the lungs. And the movement of the diaphragm comes from using the full capacity of the lungs. And this helps to stimulate the vagus nerve, which sends an immediate signal to the brain, telling the body to override that stress response and bring about relaxation. This relaxation response helps to balance the nervous system and restore homeostasis in the body. The breath is our immediate access to the nervous system, and using breathing practices along with a bit of healing touch, as we do with the DVRM, is just one way we can stimulate the vagus nerve and bring about positive change and healing in the body to better cope with and to manage some of the persistent symptoms of long COVID. So in the next video, I will demonstrate how to do the diaphragmatic vagal repair method and guide you through this practice.